Welcome to this week's Canna-Science Digest, where we'll be covering PEA for migraines, cannabis for depression, and treating autoimmune skin conditions in dogs. With one joke. I'm Lex Pelger. I do Canna Education for CV Sciences, the makers of Plus CBD, whose excellent CBD, THC, and PEA products are shipping to you anywhere in the US. On the cannabinoids, ask me anything. For the first study, you almost couldn't pay to have a better advertisement for our relief products that contain CBD, CBDA, and PEA. In this double-blind, randomized control trial, 64 participants took either 600 milligrams of PEA or a placebo, maltodextrin, a sugar. If the symptoms hadn't resolved by hour 2, they were instructed to take another dose of the PEA. That's because these researchers had previously shown that PEA, also known as Levagen Plus, appears in the blood within 30 minutes of consumption and then peaks within 2 hours of consumption. With this regimen, the people taking PEA had more of their migraines resolved, they had lower pain scores, and used significantly less of the rescue medication. They also reported 0 adverse effects. This agrees with a previous study that showed 90 days of PEA to provide pain relief for people suffering from migraines with auras, as well as another study showing PEA to reduce the intensity and number of migraines in children. I have those linked to in my Cannabinoids the People newsletter, sponsored by CV Sciences, that collects all the cannabinoid science each week. You can also see that at CVResearch.info. You can also check out CVResearch.info for the PEA page, where I'm proud to say I believe I collected every study ever done on PEA, which is just this wonderful endocannabinoid-like molecule that I think will be the next great thing in dietary supplements because of things like this and the general lack of side effects. Next, for treating depression, there was this naturalistic study of 59 patients with major depressive disorder being treated with medical cannabis via a telemedicine platform. After 3 weeks of treatment, over half of them reported a more than 50% reduction in their symptom severity of depression. About a third of the participants reported side effects, but none of them were considered serious, and the dropout rate was comparable to other antidepressant medications. This trial dovetails with other research that came out this week, showing that a dysregulation of the endocannabinoid system as well as PEA levels are linked to depression severity. Unfortunately, this article was behind a paywall, so I couldn't find out the dosages, but you often hear about people finding 1 milligram microdoses of THC to be helpful, but for others, it might take something like 5 milligrams up to 50 milligrams of THC, which is a lot, but for some people with a high tolerance, that could be just what they need. So in general, when I counsel people about using the cannabinoids for antidepressant purposes, I say high levels of CBD, moderate levels of THC, and use them for a month. We don't exactly know how the cannabinoids are causing their antidepressant effects. There's a lot of mechanisms involved there. But one of the hypotheses is that it's because of neurogenesis, the formation of new brain cells, as well as new synapses between those brain cells. And that takes time. So I always tell people, try it for at least a month. And once you've tried THC and CBD, you can also try incorporating PEA because there's some evidence there as well. If you want to see more about the antidepressant effects of the cannabinoids, check out the CVResearch.info page called Anxiety, Stress, and Depression. Finally, a case report of a dog with discoid lupus erythematosus, which is an autoimmune skin condition that affects both canines and humans. That condition is the reason for the lesions on the face of the famous singer Seal, but if he can marry Heidi Klum, then I think your dog too can have a rich and fulfilling life. But perhaps not 4 Grammys. The cause of this fairly common disease, discoid lupus erythematosus, is because of antibodies attacking your healthy skin cells. This leads to hair loss, depigmentation, and lesions that become inflamed and painful. The most common treatment is corticosteroids, but they cause an array of negative side effects in dogs. The ability of cannabinoids to lower inflammation as well as to calm an overactive immune system leads to suggesting them as a potential therapy. Also, THC seems to act via the CB1 receptors in the skin to lower the transmission of itchiness signals, which is helpful for this itchy disease. So in this case, we had a 2-year-old dog that had lesions across their nose and even on the inside of their nostrils. And they got treatments with tacrolimus, vitamin E, and a hydration lotion, and they didn't help at all. Then they tried treatment with the corticosteroid prednisolone, which led to a worsening of the lesions, as well as weight gain, increased irritability with the other people in the house and dogs in the house, and signs of liver damage. The owner did not like these side effects and started searching for alternative treatments and finally discovered a vet who would prescribe cannabinoid oils to be taken orally. They began with very low levels of a 2-to-1 THC oil, but it didn't really show improvements. Then they switched to 10 drops of a CBD-rich oil and 3 drops of a THC-rich oil, and the dog exhibited significant improvements after a few weeks. Then increasing the CBD dosage to 15 drops a day led to further improvements as well as weight loss and a return to normal playful behavior. Finally, after a year, all of the lesions had disappeared and a full blood work found everything to be in a clinically stable range. And finally, as these rather poetic researchers said, discoid lupus erythematosus remains a mysterious foe in dogs. Its origins are shrouded in a mix of genetics, infections, hormones, and sun exposure. But cannabis derivatives, beyond their pain-relieving prowess, are emerging as potential knights in shining armor against inflammation and immune system overwork in the veterinary world. Unlike traditional drugs, these compounds dance with the body's own endocannabinoid system, a master conductor of cellular harmony, homeostasis, and diverse functions. By influencing the immune response's orchestra, they can silence the pro-inflammatory drums and amplify the anti-inflammatory melodies. Swoon.